Hesitant to get the care you need because of COVID? It's affecting a lot of healthcare and our everyday lives, especially for seniors. PJ Saberton from Saberton Denture and Implant joins us now with more. And you see this anecdotally from your patients because you see your patients 4 or 5 times for the fittings of dentures and implants.
Yeah, we're in this chronic phase of the pandemic now. So the initial phase, as we know, affected seniors. They were the most hit, unfortunately, lethally. But now in this longer phase, they're not the ones having to go back to work. So those of us who have to get out of our pajamas and kind of get back in the world for workers' school, the seniors are still kind of in those routines, and it's affecting their overall health.
And that's in routines of maybe not going out, not seeing friends as much, and you're hearing from your patients that they're lonely.
Yeah, it's the physical, it's the mental, and the emotional. I mean, we were told to stay home. It was almost like the best doctor's advice to do nothing, and just you couldn't even go out to eat.
Mm-hmm.
So, but now you've got to look at those longer term health effects, because not being social can affect your dementia, the emotional side, the anxieties, and physical. You know, that sore knee 2 years ago is maybe now you can't climb the stairs. So it's important to at least address this, I think.
Mm-hmm. And so how did you see it? Like, how did you see things affecting your business? Were you still open for business, or were you considered like an essential service?
We are, yeah. And like it's a little different than the dental office, because there's 4 or 5 visits, and we don't do surgery. We're not operating on the patients like a dentist is. So it's a much more relaxed environment, and the chairs.
So people talk.
Yeah, and the chair, over those 4 or 5 visits, the chairs are upright. So we're working kind of like this, and we're much closer. So we're 3 inches away, and there's times where we're over the visits, they're looking in my eyes saying, "You've got beautiful eyes," and I have to say, like, you know, let's keep it professional, Alice,
Yes.
right? So we do, and they tell us they're lonely, and you know, it's affecting them in this phase of the pandemic in a unique way, and I think it needs to be shared.
So your advice then, if you have someone in your family who's a senior, like, just really keep that in mind, that yeah, we're, you know, for the most part going back to routine and going back to work, back to shopping, all these kind of things. But yeah, a lot of people just, you know, they had that 2 years, which you say 2 years when you're 80 is a long time.
Yeah, I mean, I have friends for the pandemic side where their pajamas did not see the inside of a drawer. You know, they wore them, washed them, and put them back on. So, but seniors haven't had that push kind of back to work. So a lot of those routines are still there from the beginning of the pandemic, that a lot of us going back to the office or meeting with clients, that, you know, we couldn't show up to a meeting in our underwear, but, you know, the seniors still may not. Some of the habits, like not going to the mailbox or not seeing your neighbors or friends.
Not checking in.
Yeah, I think the small steps at first to actually realize that this isn't going away. This is the chronic phase of this pandemic, and it's probably a good idea to assess your situation and look at your long-term kind of habits and health.
For your overall health, mental and physical. We got about 30 seconds left, but are you seeing an increase now in patients coming in? Because for the longest time, you know, we were wearing masks, so if you had problems with your dentures, it was like nobody's going to see it, but now it's coming back.
Yeah, and it's so important, and we're always aware of the mouth, and it's one of the greatest things that you can do in a short fix. And it's unbelievable, that relationship we built.
Okay.
But also the confidence.
PJ, got to stop you there. Thanks very much for coming in. Some helpful tips today.